Very much.
3 people do remain hospitalized from Monday's attack, including police officer Nicholas Wilt, who'd been on the job for just 10 days before he was shot in the head during that attack. Here's what Dr. Jason Smith, the lead doctor treating the victims, said yesterday about the toll gun violence is taking on his staff.
To be honest with you, we barely had to adjust our operating room schedule to be able to do this. That's how frequent we are having to deal with gun violence in our community. People say I'm tired, but I'll be answered. It's more than tired. I'm weary. There's only so many times you can walk into a room and tell someone they're not coming home tomorrow. And it just breaks your heart. When you hear someone screaming, "Mommy," or "Daddy," it just becomes too hard day in and day out to be able to do that. I'm a doctor. I don't know what the answers are. But to everyone who helps make policy, both at state, city, federal, I would simply ask you to do something. Because doing nothing, which is what we've been doing, is not working.
And Dr. Jason Smith joins us now. He is the Chief Medical Officer at University of Louisville Health. Doctor, thanks for being with us today. I spoke a moment ago to the mayor of Louisville about some of the victims that are still in the hospital under the care of your staff. What more can you tell us about them?
Well, first, thanks for having me on. We still have 3 of the individuals in the hospital. 1 remains in the ICU, Officer Wiltz. He's still critical but stable. The other 2 are still being treated for their injuries from the shootings.
And in terms of Officer Wilt, that he's still in the ICU, it's good news that he's been stabilized. Do you expect him to survive? Do you expect him to make a recovery?
It's still way too early in this to really be able to say whether what his long-term outcome will be. I'm encouraged the fact that we've been able to make it this long. I think our neurosurgeons and our physicians did a fantastic job of working to save his life after the shooting.
And that was echoed by the mayor a moment ago, saying your staff saved the lives of several people who came into your ER. And let's talk about your unit there. I think what struck a lot of people yesterday was when you said this was kind of another day. Yes, it was a horrific, tragic day, but in terms of gun violence, we were ready for it because we have to be. We were ready for it because we've become accustomed to it. What have you seen through your hospital, and how has that changed in recent years?
Well, this is something we now, routinely train for and prepare for. Our emergency department and our trauma center here at U of L Hospital really treats around 4,000, a little over 4,000 patients a year from traumatic injury. And a lot of those are gunshot wounds and stabbings, interpersonal violence. And so our team and our nurses and physicians in the emergency department, our surgeons on our trauma center, really work constantly to be prepared for this. And unfortunately, we are called into action way too often. And really over the last few years, it has escalated to an incredible point right now.
Doctor, I moved by your words yesterday, and especially when you said you're not a politician, you don't have all the answers, but doing nothing is not working. And we couldn't agree with you more there. I would love for you, though, to explain to us, help our viewers better understand what you do go through day in, day out, because we cover the mass shootings. We cover shootings like the one a couple days ago. But we also know that you're dealing with handgun shootings constantly. We understand the number of mass shootings nationwide just keeps skyrocketing. Talk about the daily violence that you have to endure in there.
Well, I think nothing tells the story better than in the midst of this shooting, we had another unrelated shooting where patients came in from in the city, just blocks away from where this occurred. And that was literally in the middle of our response to this mass casualty event at Old National Bank. So it's unrelenting. I mean, and I speak for Louisville, but talking with my colleagues around the country in Chicago and Baltimore and Los Angeles and Seattle and Portland, this is no different in the largest cities around the country that deal with this on a day-to-day basis. I think the one thing that happens is from the news stories and the mass shootings we get, inundated with, they're a bit sterilized. You don't see the families that are devastated. You don't hear the cries. You don't hear the wails of the parents or the kids that have to deal with the repercussions of what has occurred. And as difficult as it is, as I said, we have to begin to make some type of change to do something in our society to fix this.
And doctor, could you highlight for us the difference between the normal, terrible, tragic gunshot wounds that you may get from a handgun and what happens when you have a patient who has been shot up by an AR-15?
Well, there's simply no comparison. I mean, the energies and the velocities of the bullets that are moving from a rifle are just devastating to the human body. I mean, that is what they were designed to do. The amount of energy that is, impacted on the tissues just pulverizes the tissues. It liquefies organs, destroys and pulverizes bones, muscles. It just leaves these horrific wounds that are just almost unable to be treated because of how devastating they can be. And again, that's what they were designed to do. Handguns simply don't carry that kind of energy. And it just makes treating those patients so much more difficult, and trying to save their lives is just so much more difficult given the injuries that occur with rifles.
Now, Jason, on a personal level, I want to ask you, when you first decided to become a doctor, when you first started medical school, could you have ever imagined there would come a time in your career that guns would be the #1 killer of children in America?
No. And the simple fact is no. The amount of gun violence and the escalation that we've had really over, the 22, 23 years that I have been out of medical school, give or take, has been just unbelievable. This was somewhat isolated and was actually on a downturn in the 90s. And the uptick that we've seen, during my career and what we're seeing now is on a scale that has not been seen in this country ever. And I think that is what people need to understand, that this is a public health crisis. There are problems with gun violence in every city and every community in the United States. So we have to begin to have the discussions. We have to have the dialogues, because there's no simple answer to this problem any longer. And we have to be able to come up with complex solutions to what we have to deal with in this country.
You're so right, and Americans shouldn't be numbed by it, because you're so right. The number of gun deaths have absolutely skyrocketed even since Sandy Hook 10 years ago. Chief Medical Officer at University of Louisville Health, Dr. Jason Smith, thank you so much for being with us. We really appreciate your time.
Thank you.